Welcome back. This section is called Ask FPA. You can send your questions to tv@fpalex.com and include your name if you would like for us to use it on the air. Tonight's question is, what's the difference between internal medicine and family practice doctors, asked by Sharon B. in Lexington, Kentucky. And here to help me answer that is our newest doctor at Family Practice Associates, Dr. Rajeana Conway. Welcome.
Great, thank you. Great to be here.
All right, now you are an internal medicine short internist.
Correct.
Tell us about your training from the University of Cincinnati. Tell us about your training and how that might different or be the same as some of the other primary care docs.
Sure. So after college, all doctors complete 4 years of medical school. And then after finishing medical school, you can choose a residency. And family medicine is one residency, internal medicine is another residency. There's a lot of similarities. The biggest difference is family medicine is largely trained to take care of all age groups. They take care of children, they take care of adults, they take care of the elderly. In internal medicine, we largely take care of adults. Usually we say 18 and over. And we have a lot of training, especially in chronic disease management. So things like high blood pressure, diabetes, chronic kidney disease, those kinds of things. After your internal medicine residency, some doctors go on to pursue fellowships in things like cardiology, pulmonology, endocrinology, and then some of us, like myself, choose to become primary care doctors.
Well, we're glad you did. We're glad you're here also. You also mentioned family practice. There's internal medicine and pediatrics, a double board residency that's short for called MedPeds sometimes.
Exactly.
And they do everything too.
They do everything as well. They do everything as well.
All right, well, so why does anybody need a primary care doctor?
I think it's a great idea for everyone to have a primary care doctor, whether you have chronic medical conditions, even if you have specialists who are taking care of those medical conditions. It's great to have a primary care doctor who can help to coordinate that care, to kind of be the in-between of all the doctors to make sure that all of your medications are working well together and that kind of thing. But even for healthy patients, I think it's a good idea to have a primary care doctor that you see maybe once or twice a year to make sure that you're up to date on all of your screenings, to make sure you're getting your vaccines. And we also just keep a close eye on things like your blood pressure, your blood sugar, in order to try to prevent some of those chronic diseases from developing. We like to catch those things early.
Well, I tell some of the patients, the specialist, the cardiologist takes care of the heart, pulmonologist takes care of the lungs. The primary care doctor stuck with the whole person.
We take care of all of it. So, we like to refer out to some of our colleagues in those specialties when it, gets to a point where maybe we need their help. But we're always there to kind of manage those conditions on the backside as well.
It's also, for me, the fun part. I get to know the mom, the dad, the kid, the grandma, and you get to know a whole family and where they belong in the process.
Right.
Now, you mentioned screenings, okay?
Correct.
Tell us about some of those things that you pay attention. When somebody comes in, they might be sick or they may just need, a checkup.
Right. So big things we like to look at are vaccines, especially it's almost flu season. So right now we're big on making sure everybody's getting their flu vaccines, also pneumonia vaccines, that sort of thing. But we're also looking at other things, even in young patients, things like pap smears and mammograms and colonoscopies, and just making sure that we're preventing cancers especially.
Now you mentioned colonoscopy, and everybody dreads to hear that. When are you supposed to do it? And if sometimes I just can't talk people into doing it. Are there some alternatives, even though colonoscopy is the gold standard?
Right. So most screening for colon cancer starts at age 50, unless you have a personal family history. If your mother, father, brothers or sisters have had colon cancer, then we may do it earlier. But for the average person, we start at age 50. The colonoscopy is the gold standard. The part everyone hates is the prep, but if you get past that part, it's not so bad. But there are some alternatives if people just absolutely can't do the colonoscopy. Things like Cologuard, you'll see that advertised on TV, is actually a stool test that we use. It has to be done a little more frequently than a colonoscopy, but is a good alternative for colon cancer screening.
All right. We talked about screening and medicines. Let's talk a little bit about lifestyle. Are there some things you can do to keep yourself healthy that doesn't involve a pill?
Yeah, I mean, obviously, diet and exercise. It's as easy as that, but it's hard to do. Just trying to eat healthy, stay away from fast food, stay away from sugary beverages. Again, hard to do, but as one of the small things that you can do to improve your health. Keeping a healthy weight is important, so being as active as possible, even if it's just walking. You don't necessarily have to have a gym membership, you just have to have some gym shoes and get outside and walk a couple times a week, 2-3 times a week is better than nothing.
That's great information. Keep us healthy. We'll be right back.